kind of just looks like it stops there. Okay. Good afternoon and welcome to this episode of ANEA on the Air. My name is Deasia Lee, and today I am joined by Terry Wilder, HIV aging policy advocate with SAGE, Ronald Johnson, steering committee chair of the U.S. People Living with HIV Caucus, Dr. Jeffrey Kwon, professor of advanced nursing practice at Rutgers, and Susan Kitchen, community advocate from South Carolina. Thank you for joining me, everyone. Today, we're going to just dive into the challenges and opportunities facing older adults living with HIV and the importance of advocacy and policy efforts to support older adults living with HIV. And so, as the landscape of HIV has evolved over the years, we've seen that nearly half of people living with diagnosed HIV in the United States are age 50 and older, and many of them have been living with HIV for many years, and others were diagnosed much later in life. And so we want to hear from an advocate from South Carolina who was diagnosed with HIV a bit later in life. Her name is Susan Kitchen. Susan, can you share with us your experience of being diagnosed and how it's impacted your life?
Sure. I was diagnosed at a very low point in my life with no self-worth whatsoever. I was 61 years old in 2013. I was diagnosed June 8th, 2013. Had to go to the hospital with 7 infections. Didn't know what went wrong. I sat in the emergency. They took some blood. They took some blood, and then they left me with a sheet over my shoulders and a wheelchair and pushed me into the hall. I spent 11 and a half hours sitting in that hall with them drawing blood every 45 minutes to an hour. No nurse, no person, nobody talked to me, nothing. They just left me there. And no diagnosis. At 4:30 a.m. on Sunday morning, they put me on the heart floor because that was the only bed they had available. The night nurse was nice. She came in and did what she needed to do. Still nobody told me what the results of the tests were. At the change of the shift, a nurse came in and she didn't speak to me. She walked across the room, sat on the windowsill, shuffling papers, and she said, "We got the results of one of your tests. You are HIV positive." I opened my mouth and absolutely nothing came out. I was devastated. She waited a minute. I just laid there. She waited a minute and she asked me, "How do you feel about that?" The only thing I could say was, "That's a death sentence." She got up, still hadn't called my name, said hello, nothing. And she walked across the room to the door and she said, "The doctor will be in to tell you more." And she walked out and left me laying there. Tears coming down my face at last, but nothing coming out of my mouth. Right after she left, the night nurse came in. She grabbed my hand. She ran over to the bed, grabbed my hand, and she said, "Can I pray with you?" So she prayed. I cried. No doctor, Sunday all day. He's coming, never showed up. And not until Monday around 11 o'clock in the morning, a man came in, an older gentleman, with a nurse. And he said, Dr. Sanasi had just come in to do some blood work. She's the doctor at immunology here in Columbia. And he came in and he said, "You got 30 minutes to get your clothes on and get out. We need the room." And Dr. Sanasi told him, "So I'm not through with my exam." Well, there's nothing we can do for her until she has medications for her infections because she cannot start HIV medication until those are gone. Dr. Sanasi gave me the prescription for the antibiotics. And she said, "I'll call you this afternoon." She did. I left not knowing anything more than that I had HIV and what to do with it. Nothing, just go home. I cried and went home to die. I thought the following Friday, Dr. Sanasi had made an appointment for me with immunology and Dr. Albrecht. Dr. Albrecht is the head of all that kind of stuff in the hospital in Columbia. He talked to me for 3 to 4 hours and informed me about HIV, the treatment, and everything to do with it. He started me in a study for older women for 2 years. I learned all I could about HIV through the study, the brochure, the internet, and anywhere else I could get any information. Because of immunology, Dr. Sanasi and Dr. Albrecht, and peer counseling, I decided to get all the information I could and start advocating to try to help others. Stigma was awful then and not much better at this time.
Thank you so much for sharing that with us, Susan. You know, being diagnosed with HIV can be a very scary time in a
Mhm.
person's life, and it sounds like your experience,
It's awful.
yeah, it just wasn't the best
No.
experience. And that's one of the areas that we need to improve when we're reaching out to those who are younger and newly diagnosed, and also those who are older and being diagnosed. And
Yes,
so
ma'am.
I'm wondering for you, Susan, have you found some support services specifically tailored to older adults living with HIV?
At first, no. They put me in a group of very young people, and I just went along to learn. Okay. Uh, I started, the COVID killed everything here. And so when I started over again, all I'm getting now is just the general information for everybody. Not a lot different now, but a little bit. It's going to get better with research, but there's not a whole lot left, or for older people here anyway.
Mhm.
Just
So,
general information.
yeah, thank you for sharing that, Susan. And as I mentioned, like many people have been living with HIV for many years. I know you were diagnosed later, but as
Mhm.
someone who's growing older with HIV, Ronald, how would you say your perspective on living with HIV has evolved as you've gotten older?
Thank you. I would, looking at my situation, I was diagnosed in 1989. So it was before the time of effective treatments. The only really available treatment at that time was AZT and some other individual medications. And I was also approaching middle age. I was 41 when I was diagnosed. So my perspective from then to now really can be, I guess, summarized by saying go moving from expecting to die to living and working to age and to thrive with HIV. So very broadly that has been my perspective change of going from expecting that I would be dead by the age of 50 to now in my 70s and looking to see how I can continue to live and to thrive, what I need as a older adult living with HIV and what other older adults need and working towards that. So going from an expectation of death to feeling that I am entitled to thrive, and I want
Amen.
everyone uh, to thrive with HIV.
Absolutely. Thank you, Ronald. And you bring up a good point. People aging with HIV share many of the same health concerns as the general population as they're growing older, age 50 and above. So there's things like chronic illnesses, you know, having to use multiple medications, and seeing like the declines in kind of physical activity, cognitive ability, and things
Mhm.
like that. And so I'm wondering, Dr. Kwan, can you speak about the unique challenges and considerations in providing care to older adults living with HIV?
Sure. uh, Thank you so much for the opportunity to be a part of this program today. And I think you've hit a lot of the key points just in your little introduction there, which is, in fact, I think one of the major challenges that individuals aging with HIV experience, just in terms of a medical or health perspective, is the fact that people are dealing with multiple chronic conditions. So, in addition to HIV, we're seeing cardiovascular disease, other metabolic complications. We're seeing frailty. We're seeing mental health issues
Mhm.
all together. And not only do we see this a little bit more frequently, but we're seeing this in um, typically what we would be considered sort of in younger individuals who, may be in their 50s, whereas somebody who does not have HIV may experience some of these things when they're later on in life. We're seeing higher rates in individuals who are a little bit younger, which makes it a little bit more challenging for healthcare providers, as well as obviously persons living with HIV and aging with HIV, as well as the healthcare system in general, in terms of managing all of these things.
And so something Ronald hit on earlier is that a lot of people living with HIV didn't kind of expect to become older and reach a older age. And so there's a lot of fear and trepidation sometimes around issues like switching from private insurance to Medicaid or Medicare, managing other chronic health issues, as Dr. Kwong just mentioned, transportation issues with getting to providers when you can no longer drive, still maintaining adherence when you have these cognitive declines like Alzheimer's or dementia, or even when you may enter a long-term healthcare facility or a nursing home. So, Dr. Kwan, how can healthcare providers better address the specific challenges and concerns faced by older adults living with HIV?
Sure. I mean, I think that this is a very complex question, and of course, there's no one simple answer. I mean, I think just in terms of how can healthcare providers better address the needs, I think one is to become educated and familiar with HIV, or specifically some of these issues that we're talking about today, for people who may not necessarily feel like, they may be geriatric specialists or older adult healthcare providers, and they haven't really thought about HIV and how that plays a role. So just becoming better educated around those concepts and needs is important. And the converse is true as well for HIV providers, to understand that, yes, taking care of somebody who's aging with HIV is not just taking care of somebody, who is now 60, 70, or 80, and it's just sort of the same primary care piece that people have been doing. We have to remember that geriatrics, or the field of geriatric medicine, is truly a specialty in and of itself. And so there are issues that, the generalist HIV provider may not necessarily be aware of if they don't work in this space a lot. And so I think education is important. And of course, talking about and addressing issues of ageism and stigma on all sides of the picture are so important, because, I think our population of persons aging with HIV sort of deal with multiple levels of intersecting issues. And now, layered on top of things such as HIV stigma, there's also the issue of ageism, which is something that's a unique challenge in itself to deal with.
Mm-hmm. And Terry, I want to bring you into the conversation. How can we ensure that older adults are not left behind in our current efforts to end the HIV epidemic?
Yeah, I mean, I think it's something that is a really interesting place that we are in history. Like, as said before, I think medical providers, probably our community at large, never thought that we would be at this place, that we would think about aging and HIV, because, I know in the late 80s, I did not think that, my friends would still be here in 2023. So, I think a key piece is continuing to have programs like this, raise awareness, give testimony at spaces that you can about the lived experiences of people aging with HIV. I think the other thing, from a policy perspective, is to really advocate strongly for funding sources like Ryan White funding, HOPWA funding, to really start thinking about, how are we going to serve the unique needs of people aging with HIV? 50% of all people living with HIV right now in the United States are 50 and older, but by 2030, that's going to be 70%. So what are we doing now to make sure that these services are in place for folks around quality of life? And to Dr. Kwong's point, what are we doing now to make sure that, the AIDS education training centers that are part of Ryan White funding are getting funding that's going to meet the needs of the medical providers who are serving the aging client, because it feels like HIV is kind of over here and the aging services system is over here. And how are we going to bring each other together to make sure that we're sharing best practices and collaborating and working together? I just think that we need to keep bringing up the issue. I think sometimes it can feel like, we may be bringing up the same message over and over again, but I think, consistently bringing this up is a way to raise awareness that they can then purposely move things for change.
Thank you, Terry. And Ronald, I kind of want to ask you a similar follow-up question, like what more needs to be done at the federal and local levels to ensure that older adults living with HIV receive the support and resources that they need?
Well, following up on both what Jeffrey and Terry have said, it really, I think, we need sustained and intentional actions and approaches. There has been a lot of attention over the past 3 to 4 years to the issue of HIV and aging. So the awareness has greatly increased. We need more, as I said, sustained and intentional efforts to change the kinds of models of care so that we can have better integration of HIV care and geriatric care, the kinds of conditions that Jeffrey spoke about, and chronic conditions. We need models of care and that are funded and very well implemented. We have examples. There needs to be, I think, more intentional effort to replicate that. One example that I also would cite on the federal level is making better use of the Older Americans Act. I think we've had an opening just recently. The Administration for Community Living that administers the Older Americans Act is being more forceful with states and saying, getting states to identify older adults living with HIV as a population of greatest social need. I think that's an example of the kind of intentional approach that we need to make sure that not only there is federal action, but it is being translated and filtered down to the state and local levels. And in addition to the Ryan White program, programs like that are funded under the Older Americans Act can be that conduit to make sure that things move from the federal level to the state level and to the local level to change the programs, to change the models of care so that older adults living with HIV do not feel as forgotten as so many of us feel now.
Can I just add something that's kind of related to what Ronald is sharing, and then something that was mentioned earlier, which is, thinking about long-term care. I know that many of my friends who are aging with HIV don't have children, or they may not have friends that are in their network that could help take care of them as they age. Folks may end up in long-term care facilities. So, there's efforts that are being made across the country to implement LGBT and HIV long-term care Bill of Rights, so that people are protected from being discriminated against, from even being accepted into a long-term care facility, also protected from being discriminated against while they are living at a long-term care facility, and then also requiring that the staff at those long-term care facilities be trained. So we have to think about, long-term care facilities, and are they ready to take care of our friends and families who are aging with HIV. And then, as I was listening to Susan, I was thinking about the fact that the CDC's HIV testing guidelines still say that the recommendation is to offer an HIV test to people age 13 and 64. So what about people 65 and older? So really advocating to remove that upper age limit so that we are offering people an HIV test who are 13 and older. Because we certainly know of people who went years and years and years without knowing that they were living with HIV. And by the time that they found out that they had HIV, they had advanced disease and sometimes even had an AIDS diagnosis. So it's, really making sure that people get offered routine testing so that they can take care of their health. And we know that routine testing is also a gateway to HIV prevention services like PEP and PrEP. Older adults have a right to have access to those HIV prevention tools as well.
And so, Terry, you mentioned a lot of kind of unmet needs and concerns of older adults living with HIV, and that kind of brings up the importance of, advocacy and policies for this population. Can you speak to like why having those policies and why advocating for this is important?
Yeah, because my friends' lives matter. I mean, honestly, I am 55 years old. So I'm an older adult, too, although I feel like I have the brain of a 13-year-old. So, I just feel like, these policies are important for quality of life. And I feel like people deserve to have a right to healthcare, and healthcare is prevention healthcare, and it's, care for treatment. And, I think we need to respect the dignity and lives of people who are aging. Dr. Kwong talked about kind of this intersection of HIV stigma and ageism and how it compounds the experience of a person who's living with HIV or vulnerable to HIV. And, there's so many things that we need to dismantle. But I think at the end of the day, the reason why this kind of advocacy matters is because the people in our community matter, and they deserve to be treated with respect and have access to all the services that should be available to them, like Ronald talked about, like services through the Older Americans Act. Really thinking through that legislation now and how it can really help people living with HIV in our community.
And Ronald, I want to ask you, because I know you sit on the U.S. People Living with HIV Caucus, and so I want to ask you, how can policymakers better integrate voices and experiences of older adults living with HIV into policy discussions and actual decision-making processes?
Thank you for that question. And I really think it really gets to the heart of what it means to be engaged with the community and to make sure that older adults living with HIV and other people living with HIV there's not only outreach, but there's engagement. We just 2 weeks ago commemorated the 40th anniversary of the Denver Principles that articulated what the rights of and responsibilities of healthcare professionals, what people living with HIV, their rights, and seeing how the Denver Principles were translated into the greater involvement of people with AIDS and the meaningful involvement, MIPA. These are the guide stones, if you will, for government officials. And I think it really comes down to making sure that we are the proverbial at the table, but involved in program planning and decision making, making sure that the planning councils that are established under the Ryan White Care Act being, again, and I used the word before, intentional about involving older adults and with HIV. So that ongoing dialogue and involvement, I think, is crucial to the question that you just asked, and of how can officials be in touch is to reach out and stay in touch, and making sure that engagement is not a soundbite, but it's a very real process and an ongoing process of engagement and involvement.
And a word you use a lot is intentional. And so, Dr. Kwong, I kind of want to ask you, how can healthcare systems be intentional about ensuring that they are providing comprehensive and patient-centered care for older adults living with HIV?
Sure, absolutely. I think, one of the first steps is to look at healthcare organizational policies where people practice, and making sure that there are policies, even just within if it's a hospital or a clinic, or even a larger healthcare system, that there are intentional either trainings or mandatory policies that have been put in place that help ensure both access to care, that people have the right to be in a safe space where they receive their health care, and that that healthcare providers either seek out mandatory, because all healthcare workers, most licensed healthcare providers, need to have ongoing continuing education. So can organizations intentionally say that part of your requirements are that you focus on HIV and AIDS, or some aspect of the puzzle that will help ensure broader knowledge and acceptance and comfort levels of the healthcare providers in caring for persons aging with HIV. Other things that healthcare systems can do is, to partner with, or to have something very much, as Ronald alluded to, maybe a community advisory board, or to partner with community-based organizations that serve persons aging and thriving with HIV, to provide feedback or guidance, or to seek that level of community engagement, I think, is also very important as well. I don't know, those are the things that I think of off the top of my head.
Yeah, thank you, Dr. Kwong. And so this question is kind of for everybody's. How can we better raise awareness about the unique challenges of older adults living with HIV and the importance of supporting this community? And that's for anybody who wants it.
Well, I think this program is a perfect example of the kinds of efforts, and we need to be more vocal, or we need to make sure that there is that recognition, as Terry pointed out. People over 50 already constitute over 50% of people living with HIV. That visible presence needs to be more highlighted, and not to block out other populations, but to recognize that the growing majority of people living with HIV are going to be 50 years and older, and all of the implications that flow from us. Just recently, this week, I think, in news about how the population as a whole in America is getting older. So we need to capitalize on that bit of awareness to make the issues of HIV and aging, and the issues of older adults known. And while I certainly appreciate the focus here on older adults, we must also recognize that long-term survivors, that is, those who have been living with HIV for 10, 15 years or more, uh, includes people who are under 50 years of age, including people who were born with HIV and who are now in their 20s and 30s. They are long-term survivors. They are part of the aging population, the kinds of conditions that Jeffrey spoke about. They may be experiencing those chronic conditions that are usually associated with older adults, people in their 20s and 30s who have been living with HIV throughout their lives may be experiencing that. So all of this, I think, can help raise the awareness. So that's one perspective that I have on the question.
Deisha, I'll stick something in here. I think we ought to start targeting advocacy to groups of older adults. Just because we're older doesn't mean we don't enjoy or even have sex anymore. Besides, if grandparents and older adults know and share with their grandchildren and their younger children and younger people, we can better prepare them for their experimenting years, because we know they're going to go out there and have sex. That's just it. They're going to do it. We can warn them all we want. We give them the information to prevent not only unwanted pregnancies or unwanted STDs, but because they really think they know it all and they think they're invincible. But if it will ruin their lives if they're not prepared. But if we could prepare the grandparents and the older people's example, we advocated before COVID to a group of the NAACP in Orangeburg here in South Carolina. And we did our program and everything, and they asked for questions. And the women that went all dressed the same way. Okay, it was a group. And they didn't ask us if were we positive or not positive. We were just advocating for it. And one lady stood up and she said, I want to ask that lady a question. And it was me. I'm like, okay. And she said, if I know I'm not positive, I said, well, how do you know? Well, if I have the test and I find out I'm not positive, how am I going to, how is that going to prepare me to advocate or to be aware of this? I asked her, I said, well, do you have children? She said, yes, they're all grown up and have families. I said, what about your grandchildren? And she said, well, yeah, she said, well, they're just about teenagers. I said, perfect place for you to start. Tell them, prepare them, get information, because most schools and most churches and other organizations won't let you tell the children, the younger people, about condoms or how to protect themselves because they want them to be abstinent. Okay. But if their grandparents and their older adults knew this, like NAACP, AARP, Veterans Association, Assisted Living, Shriners, anybody that's Red Hatters, anybody that's older and in a group, they need to be just as prepared, even if they don't have sex anymore. They need to be just as prepared with information that they can advocate to their grandchildren and to their grandchildren's friends. And that way, I think it would be preparing them, not only informing them, but they can pass that on down and pass it to the younger people in their lives and in their children's lives. Thank you.
Thank you, Susan. And Dr. Kwan, you wanted to add something?
Yeah, yes, if you don't mind, I was just going to, to go back to your question about how can we raise awareness. There are obviously national days of recognition for Long-Term Survivor Day. There's HIV and Aging Day. There are things. Social media is a great tool, but I really think there's a lot of power in just speaking and talking within the community. I think people get very scared, or they get insecure about talking to legislatures, or writing an article in your local paper, or doing an op-ed piece, or doing something even at the very grassroots level, and just talking to people and telling the story. And to people who will be out there who are wanting to listen. I think people just get intimidated by that sometimes, and I just want to encourage people that it's okay. You can go out, you can do it. You can do public commentary. You can speak to your local Rhine-wide planning board. You can speak to your local policymakers. Anything within your community or county would be helpful. So that's another way to raise awareness.
And Pacha is happening this week, the presidential group. And so that's a great opportunity to bring up HIV and aging. I agree that it can be intimidating sometimes to do this work. But, we have great tools. If folks have a pencil and a piece of paper, you can write letters to the editor. And, if you are an amazing writer, you have this beautiful gift and tool. Sage just published a piece in Forbes about HIV and aging and HIV testing as a way to raise awareness. And I would encourage folks to kind of think outside the box. Sometimes it feels like our work is a little bit of an echo chamber talking to each other, but think about these spaces that some of folks have already mentioned, but like the American Society on Aging has a conference every year. There may be local kind of aging, kind of generic conferences, see if there's opportunities to speak there. And, if there's opportunities to get before some kind of aging department in your state or your city to raise awareness about this. Because like I said earlier, I feel like we're still a little siloed with the HIV community over here and the aging community over there, and that we really need to be talking to one another. I just think there's a lot of opportunities if we just kind of look and click around and see kind of what's out there in the aging space. And you'd be surprised, there's some folks that are elected officials that aging is like their number one priority. So introducing HIV to them as well might be a great ally to start with.
Awesome. Thank you so much for sharing all those ways we can raise awareness. And so as we wrap up this really rich conversation, I did just want to ask everyone, what's one message or piece of advice you would give to those long-term survivors who may be under 50, maybe they're my age, around 30, and they're growing older, living with HIV, and also those who may be diagnosed much later in life? Like, what advice or what message would you say to them if they're listening now? And that's right. Go ahead, Susan.
All right. If I had one piece of advice, I would tell them to educate yourself, prepare yourself, and learn all that you can and eliminate the people in your life that shun you. It's their loss, because we're all good people, positive or negative. Stay as healthy as you can with the aging process, because there are a lot of other things, like the doctor said, chronic things. I have 6 chronic things going on. If one messes up, it affects the whole lot of them. And you can't do that when you have HIV. If you mess up something, it's going to affect everything. And it's going to take your life to a different level. I think they should strive, people living with HIV should strive to achieve and maintain viral suppression. Remember, U equals U, undetectable, untransmittable. I achieved that after 3 months of medicine in October 2013. That's all it took, because I did what I was told to do. If we could make sure that people understand that you can live with it, like Ronald said, for a long time. I mean, I know people that have had it 50 years or since the early 80s, and they're still alive. And they had AIDS and they're still alive. But they do what they need to do. And by educating themselves and keeping up with the best things that are going on, keeping up with what they can do to stay healthy and what they need to do to stay healthy, then I think they can, I think they're living with HIV. You can achieve that. And if you maintain it, you can't give it or transmit it to your sexual partners. So there's one thing, we're not giving it to anybody else, but I really believe that if you try to get yourself healthy and tell other people, you can't be quiet about it. Oh, you're aging great, you're looking good, all that. What's going on? Well, besides the 6 chronic things that I deal with every day, I'm HIV positive. What do you mean you're HIV positive? I tell people that and they look at me like, oh, you're not, you're lying. I'm not lying. I deal with it because I want to live a longer life. I want to be able to help other people live a longer life. And the only way that I feel you can do that is to keep up with what's going on and prepare yourself at any time to talk about it. Scares the fool out of me sometimes to do that. But the more I learn about it, the more I learn about being undetectable and what it takes to do it, the more I can tell other people and share with them. And I think that's a big part of getting rid of this stuff and getting older healthier.
I mean, I guess my message or piece of advice would be, get connected to community, whether that's, getting involved with the Positive Women's Network, which has national presence and also has chapters across the country. It could be getting involved in your local HIV service organization or your Y&Y Planning Council. It may also be that, like Susan mentioned, that there was not a support group for people who are over 50. It may be that you are the one who creates the community. You start your own support group. I'm a social worker by training, and in the 90s, I had a client who was a great grandmother who was diagnosed, and there wasn't a support group for older women in Minneapolis, Minnesota in the 90s. And she started one, and people came, and that is the way she helped create her own community.
I want to, as a message, I want to echo what I think is appearing in the chat, or that particularly the message to those of us who are living with HIV, as well as our allies, that we are entitled to good quality of life. And that means we are not more than our viral load. As important as being undiagnosed, being undetectable is, there is more to our life than that. And it's more to what we need to have, what we can expect, and what society can responsibility to us to make it, to ensure that our full quality of life, housing, food, mental health, sound sexual health, all of the elements that make up for quality of life, we are entitled to, as is everyone is entitled to. And I think that's the message that I'm hopeful that a person newly diagnosed with HIV, or having lived with HIV for 30 or more years, can absorb and to believe that you are entitled to sound, good quality of life.
And I would say, just to add on one little piece to consider, just in terms of, what is one advice that you can take away, is just to make sure that you have and trust and have a good relationship with your healthcare provider, whoever that is, to make sure that, that there is open communication between the two of you, that they are there to work for you and with you to help achieve that quality of life. And if you're not getting that type of relationship, or you don't feel that that's there, to definitely consider, finding that person that will help with providing and guiding you to achieve the better quality of life that everyone deserves.
Absolutely. Thank you all so much for sharing. There were a lot of good nuggets in that, and also from our viewers on Facebook. And I just want to say there are so many ways we can support people growing older and living with HIV. And some ways are to stay informed by educating yourself about HIV and aging. You know, that includes the latest research, treatments, policies. Knowledge is power. Support organizations. So organizations doing work in this space, always make sure to support them, and also advocate for policy changes and raise awareness. You know, we all have a voice, and it's very important that we use that voice. So I would just like to thank all of our guests for joining this episode of ANEA on the Air. And we would also like to thank those of you who've been watching for tuning in. Please take our survey, which we're going to pop on the screen really quickly, and let us know what you thought about this episode. And also make sure to follow us on Facebook, Instagram, and Twitter at Act Now End AIDS. And so I'm also going to drop the link on our Facebook page shortly after this stream ends. But thank you so much for watching, and join us next time. Thank you so much.